Picture this. You're on the trip of a lifetime, a luxury polar cruise surrounded by nothing but pristine, untouched ice. Sounds amazing, right? Well, until the voyage is completely derailed by a deadly, incredibly rare pathogen. Today, in this explainer, we're unpacking the tragic suspected hantavirus outbreak aboard the MV Hondius. We're going to look directly at the recent reports to understand exactly how an isolated vacation essentially morphed into a massive international health crisis.
3. Now, it's a small number, but it carries an absolute ton of weight here. That's the number of lives already tragically lost to this suspected rare infection. Before we dive into the wild international logistics and the medical mysteries of all this, we really have to ground ourselves in this human cost. We're talking about a Dutch husband and wife, aged 70 and 69, and a third unidentified passenger who, heartbreakingly, lost their lives. Keeping this human element front and center really anchors everything we're about to discuss when it comes to the sheer, desperate urgency of the medical response.
All right, let's jump straight into part 1, Crisis on the MV Hondius.
So, the MV Hondius itself is operated by a Dutch tour company called Oceanwide Expeditions. And this thing is specifically designed as a polar cruise ship, meaning it's literally built to travel to the ends of the Earth, carrying roughly 170 passengers and a crew of about 70. But the absolutely crucial thing I want you to take away here is the concept of a closed ecosystem. A ship like this is effectively a floating, isolated community, right? When a severe pathogen gets loose in a confined space with around 240 people, and you are hundreds of miles from a mainland hospital, well, the variables for a disaster multiply instantly. And remember, this closed ecosystem was moving across some incredibly remote territory. After kicking off its first leg from Ushuaia, Argentina, the ship sailed deep into the Atlantic. We're talking stops in incredibly isolated places like the islands of South Georgia and St. Helena. But fast forward to Sunday, May 3rd, the day the critical reporting dropped. The ship's journey was completely halted. It was basically stuck in a holding pattern just off the port of Praia, which is the capital of Cape Verde. I mean, they were literally within sight of land, but totally stuck without authorization from Cape Verdean authorities to disembark the patients who desperately needed care. And, this crisis didn't just stay contained to the ship's hull. The victims were scattered all over the map, across entirely different continents and healthcare systems. The 7-year-old Dutch man we mentioned, he fell ill and passed away on the island of St. Helena. His 69-year-old wife passed away in a hospital over in Kempton Park, South Africa. A third, unidentified person tragically died right there on board the ship. Meanwhile, you've got a 69-year-old British man who tested positive for the virus, fighting for his life in intensive care at a private facility in Johannesburg, and 2 crew members actively sick on the ship. So you see, this isn't just an isolated incident anymore. It's a rapidly moving geographical emergency.
Which brings us to part 2, understanding the hantavirus. So what exactly are we dealing with here? Well, hantavirus is a rare infection, and it's usually caught through contact with the urine or feces of infected rodents. And honestly, that single fact immediately raises a massive epidemiological mystery. How on earth does a primarily rodent-borne virus spark an outbreak on a luxury icebreaker? Like, was it contracted during one of those remote island stops? That is the exact puzzle that global health officials are frantically scrambling to solve.
And when this virus actually enters the human body, it is brutal. According to the U.S. Centers for Disease Control and Prevention, it causes 2 very distinct, highly severe syndromes. On one hand, you have hantavirus pulmonary syndrome, which aggressively attacks the lungs. On the other, there's hemorrhagic fever with renal syndrome, which goes straight for the kidneys. Both are incredibly serious conditions, which really explains the rapid fatal decline of the passengers we were just talking about.
Now this is where the global health alarm bells really started ringing. The World Health Organization issued a stark warning. While it is rare, hantavirus infections could actually be spread between people. And wow, this is a massive piece of context. Since hantavirus is almost always transmitted from rodents to humans, the mere possibility of human-to-human transmission completely blows up the risk profile. Suddenly, that densely populated, totally isolated cruise ship, it becomes a potential tinderbox for a much wider outbreak.
And to make matters even more urgent, there is absolutely no specific treatment, no cure. The only real medical recourse here is that early medical attention can increase the chance of survival. This stark medical reality perfectly explains why local authorities and the cruise operators were in an absolute, desperate race against the clock to evacuate those symptomatic crew members, because literally, every single hour they spend on that ship without intensive hospital care actively lowers their odds of making it through.
Let's move on to part 3, the international medical response.
So,
Oceanwide Expeditions came out and stated that their absolute priority was ensuring adequate and expedited medical care for the 2 symptomatic crew members. But look, getting sick people off a boat sounds super simple on paper, right? In reality, when you're floating out in international waters carrying a potentially highly infectious and deadly virus, just getting the coordination and authorization from local health authorities to disembark, that becomes an incredibly delicate, high-wire diplomatic challenge.
Meanwhile, the World Health Organization is looking at the much bigger scientific picture here. They are actively investigating and sequencing the virus's genome. Essentially, they're playing detective, hunting down the exact genetic fingerprint of this virus to figure out if this specific strain has somehow mutated to allow for human-to-human spread. They absolutely have to confirm what they are dealing with to protect global health, all while trying to facilitate those urgent, life-saving medical evacuations from the ship.
Managing a crisis of this scale requires an incredibly complex, high-stakes web of diplomacy and healthcare infrastructure across 4 totally distinct nations. You've got Cape Verde evaluating the ship sitting right off its coast, then the Netherlands, where the tour company is based, stepping up to lead a joint effort to repatriate the 2 sick crew members and the body of the deceased passenger. At the same time, South Africa is actively treating patients in its local hospitals, and the UK's Foreign Office is constantly monitoring the situation, standing by to support British nationals. It is literally a highly synchronized, massive global operation.
Which really brings us to a critical final takeaway today. As global travel just continues to expand into the world's most remote, untouched locations, we're talking polar cruises to South Georgia, how can international authorities better prepare to rapidly respond to rare viral outbreaks at sea? I'm going to leave you with that thought to chew on. Because the tragedy of the MV Hondius isn't just an isolated freak event, it's a stark stress test of our entire global health infrastructure. Thanks for hanging out with me for this explainer, and remember to keep questioning the systems that connect our world.